One of the biggest misconceptions that people have about therapy is that it has to be this very extensive, deep, going back to your earliest childhood process in order to make a difference. A good therapist can actually engage with a person pretty much immediately in the first session, addressing the things that are going on that are causing distress, and a lot of progress can be made in a relatively quick period of time. For sure, there may be underlying, deeper-seated, or sort of more extensive issues that might benefit from some longer-term psychotherapy, but one of the biggest misconceptions is that it has to be a really long-term process. It doesn't. Change can happen pretty quickly.
Somebody should feel fairly comfortable with their therapist, be able to establish a confidential bond, feel like they are in a safe place where they can express themselves frankly to an understanding ear, and to someone who can help them feel more grounded and provide them with tools to handle some of their negative emotions. And what I say to my patients is, whatever you say to me, I'm going to take to my grave. I literally do say that. As creepy as it sounds. Sorry, camera. I know, it is super intense, right? I know.
Most important thing, I think, is to stay engaged in the things that are important to a person, that lend meaning and value and sort of bring pleasure to their life. Now, sometimes when people are depressed, they don't feel in the mood to do something, or someone who's anxious feels too fearful to go and do something. It's really important not to give in to those emotions and just to try to stay engaged in the things that are meaningful. Certainly things like getting plenty of sleep, exercise, seeing friends, those all make a difference as well.
The difference between psychotherapy and psychiatry is that psychiatrists are medical doctors. They're able to prescribe medication. They went through medical school, they attended residency, and oftentimes did receive specialized training. And psychotherapists are individuals who are able to treat mental health issues of any kind. So some psychiatrists just provide medication. Other psychiatrists are psychotherapists as well and will do talk therapy. At the Midtown Practice, we have psychiatrists, we have psychiatric nurse practitioners, and then we have psychotherapists all under one roof. So sometimes the best idea is to come and talk out how you're feeling, and with the guidance of a professional, make that decision.
For someone who's contacting us with a certain level of sort of anxiety or mild depression dealing with work-related stressors, even though medication might be helpful, our preference and our recommendation generally is to steer people initially towards psychotherapy, because in psychotherapy, in addition to getting some help, you learn some skills and some approaches and some perspectives that you can take with you even when you're done with your treatment here, whereas with the medication, that can be very helpful for people while they're taking the medication. But then when they stop the medication, typically they lose the benefits, whatever they were getting for that. So it's not necessarily, it doesn't teach the person as much. With someone who's thinking about coming to psychotherapy, sometimes the scariest part is just summing up the motivation, the willingness to actually talk to someone else about what's going on with them. I remember vividly a married woman in her 30s who had a history of binging and purging going back for more than a decade, and she'd never told anyone, and it was really weighing on her. And actually, during a 5 or 10 minute phone call, she told me about this behavior that she'd had, and she told me she never told anyone before. And when I saw her 3 days later for her initial appointment, she reported that she already had experienced a lot of relief just on account of having talked about it, and she'd really cut down in the binging and purging even before she walked into my door. So opening up, being willing to open up is a scary thing, but it's also one of the most powerful things to help people get better.
The process in order to book with us and make an appointment begins with patient or client reaching out to us. You can reach out to us via email, you can reach out to us via call, and then we set up a time to speak to you, and you'll be speaking with a clinician. You'll be able to tell us hopefully a little bit about what's going on and how you're feeling as frankly as possible, and we will help match you with a clinician who we think has the appropriate expertise as well as manner to treat you best.